CareAsOne is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipti Desai.
Hello everyone. Welcome to The Future of Health with CareAsOne. I'm Dipti Desai, the director of CareAsOne and the host of this podcast series. For those of you that are new to CareAsOne, it's a large virtual community that brings together various stakeholders in the care cycle, from providers to payers, pharma to clinical researchers, startups, visionaries, luminaries, universities, and more. The mission of CareAsOne is to truly care as one by creating a connected healthcare community where the patient is at the center of care. The entire ecosystem comes together to care as one through knowledge sharing with the help of thought leaders to discuss challenges, gaps, solutions, and transformations that are essential in making healthcare whole again. The interaction and networking between the stakeholders is made possible via a number of mediums like summits, webinars, roundtables, leadership circles, and podcasts. In today's podcast episode, I will be talking to AJ Loiacono, the CEO of CapitalRx. His mission is to create the first efficient market for prescription prices and provide employer groups with the highest standard of patient care. AJ has spent his career studying the pharmaceutical supply chain and producing engineering solutions that have continually redefined the pharmacy benefit industry. AJ is a serial entrepreneur with over 20 years of experience, and today he will be discussing drug pricing, efficiency through technology. Thank you, AJ, for giving us your time, and our listeners would love to get to know you better. So can you tell us briefly about your journey and how you got started?
Sure, absolutely, Dipti. Thank you so much for having me. So I think you caught it at the beginning of your great introduction, which is I've spent most of my adult life studying the pharmacy supply chain and drug pricing at this point. And what makes me kind of unique is I've spent my entire career in software development in one capacity or another. And also, I spent half my career on pharmaceutical manufacturing and the other half on what we call the payer end. So basically the alpha and the omega, from where a drug is manufactured to the end place where it's administered and fulfilled to the patient. And this has given me a kind of front row seat to what I like and mostly dislike about the pharmacy supply chain. And, how can we improve upon that? Not just from a pricing perspective, but even a service and an administration standpoint. And so we created CapitalRx. The name CapitalRx was born from a desire to create an efficient market, an efficient capital market, as well as we believe the real value in healthcare is human capital. I mean, why do we have healthcare? It's to improve the lives of the patient, their loved ones. And we wanted to make sure that we could always focus on that. Let's focus, once we solve for price, let's focus on outcomes and a better service experience.
Wow. Yeah, no, I mean, truly, your passion is to work on drug pricing, and you saw that was broken and that you had the cure for making it better, right? And your company wants to bring down the cost of medicine and bring in transparency using technology, because that's your background, software engineer. So can you tell us a little bit more about this clearinghouse model that your company, follows, and also share the vision and purpose? I mean, when you started this company, you wanted to make an impact, right?
Yep.
And so it'll be great if our listeners can hear about your passion.
Yeah, I think when we, our model, when we started the company, and our mission was to change the way drugs are priced and serviced to create enduring social change. And the enduring social change is important because everybody fills a prescription at one point in their life. And it's very rare you get to really interact. Technically, your total addressable market is everyone in the country. And so we realized there was a real opportunity because there was also a lack of innovation. Over 20 years in healthcare, particularly on the pharmacy benefit side, the model never changed. And I think one of the reasons why the model never changed is it never had to change. It's an inelastic demand curve. It doesn't matter what happens in the marketplace. Patient utilization holds rock steady. And, to be fair, most drug prices escalate, increase over time. And so you don't innovate, you consolidate. And I think this is what we saw quite a bit over the last 20 years. And it kind of led us to this point in history where now I think you're seeing a change. And so we're one of those change agents where we said there could be a better way to do this. And it incorporates a lot of different strategies. It's not just supply chain and pricing and transparency. A huge part of it is technology and efficiency. Why do people need higher margins is because it's perceived the costs to administrate these services are so costly. And my point is, how can you ever bring the price down if you don't have a system or an infrastructure that speaks to greater efficiency? If we had a factory making sneakers and we have to charge $400 for a pair of sneakers because our overhead costs are $300, then sure, that seems fair. But what if we could make the sneakers for $50? Do we have to charge $400? The answer is no. You don't have to. You can bring the cost down and still make equal to or more money, perhaps. But what we wanted to focus on with the technology side was efficiency, efficiency, efficiency. I often say, there are 500 companies you could talk to, 1,000 that have beautiful front end and cool apps that engage with patients. I often say Capital RX, we're the best plumbers in healthcare. We're the people that roll up their sleeves and create automation and process workflow for accumulator files and eligibility feeds and call center integration and network management and billing and remittance and all these things that scale through people. And I said, why? Why don't we create a true enterprise pharmacy platform where I genuinely think the future of healthcare isn't going to be decided by Capital RX. I think it's going to be decided by probably all of your guests and many people in generations to come after me. But you need the infrastructure. And I point this out in, the mission statement that I feel like we've inherited over time as we go into our 5th year of operations is really to give the country the infrastructure it needs for the healthcare it deserves. And I think that becomes critical, not just for ourselves and our mission, but anyone who wants to improve healthcare.
I mean, you guys are the change makers, I have to say. And, and entrepreneurial journey is fraught with change, right? And you're trying to change the way people are doing their work. But sometimes you could be making a wrong decision or a misjudgment, or you could be in the wrong place at the wrong time sometimes, right? Mm-hmm. And so have you had this experience? Because I think what you're doing is truly transformational. And I know it's like an uphill battle sometimes. So do you feel comfortable sharing a story about something you wanted to do and didn't turn out quite the way you wanted it? And if so, can you discuss the takeaways or the lessons learned from them?
If you had my team on the phone, they'd be like, we've got a story every week. No. And I think that's fair. I think I know, the best entrepreneurs will always make mistakes. It's, do you make the same mistake more than once? And I call this the furniture in the middle of the night. So you get up in the middle of the night and the lights are off and you run into a piece of furniture like, ow, that's the coffee table, or, oh, that's the chair, or maybe it's your dog. Sorry. But I think the whole point is that when you wake up the next night, do you remember where the coffee table is? Do you think, you know what, probably the dog is camping out there as well. Let's avoid that. And I talk about this all the time to my team is we're always going to make mistakes. But I point out it's almost impossible to break a company. And this is a lesson people don't necessarily understand, which is I think the most damage you can do is not making a decision, is just hesitating. And time is our most important asset. I tell my teams over and over and over again. So we need to make decisions. And if you put an equal amount of heart and brain into the decision, I'm never going to fault anybody. And I think this is part of it, which is, you talk about mistakes. I could spend an afternoon telling you a funny story and sometimes serious story of, ooh, we shouldn't probably do that again. But I think what's more important to remember is how do you address these things and remember them and learn from them. So this is my third company. I've been doing this for 21 years and counting. So I am not on the youthful side of the entrepreneurial curve. But I do want to point out is with that experience comes running into furniture and being, let's avoid that. Let's not do that. And, so let me give you an example that I ran into headlong even in this company. And it's sometimes the silliest things. And you have to kind of wake yourself up from that slumber and be like, no, this is not important. Let's focus on something that's important. Our company logo. You start a company, you get a domain name, you obviously have a logo, you're in business. It's like, the characteristics of actually having a company. It's sad sometimes there's a logo and a domain name. I can do business. You can send me email now. You can visit a website and learn more about me. And, I think there are two things, so when we started, our domain name was cap-rx.com, caprx.com. And it wasn't a great one. The problem was someone was squatting on capitalrx.com, and I didn't have the time or money to chase that down. Eventually, 3 years later, we would. And, I think it's, you focus on what's available and what you could change. And I'm like, this is a fine domain name. Our logo was a work in progress. It was myself, Ryan, and Joe, my co-founders. We literally whipped this up on a napkin, literally in an afternoon. And this was not a professional mission, but we got it done. And we knew eventually we'd hire someone to get it done. But I fell into this trap with the logo almost, which I was just like, it doesn't look right. Is this the right Pantone blue? Is this none of it mattered. None of it. And I had to be like, literally, this is the chair in the middle of the night. Walk around it, move forward. This is not going to be your logo forever. And it wasn't. We hired a wonderful graphic designer, Donna, who joined our team, and she helped us obviously craft our brand. And I think these are magical moments, in any companies, but sometimes it's the silliest things you could find yourself getting caught up in. And you have to remind yourself, no matter how long you've been doing it, let's move forward.
That's so true. In a company, you got to wear all the hats and you do things that you're not usually accustomed to. But going back to, supply chain and pharmacies and sponsors, let's talk about this wall. There is this wall that exists between the pharmacies and the plan sponsors. And how does Capital RX remove this mystery of prescription drug pricing?
Well, I think what's an interesting aspect of the U.S. supply chain is that the last hop in the supply chain, the pharmacy and the patient, is often the most inefficient point in the supply chain. And why? And I think it's because we don't have a standardization of price. I feel like in any efficient market where buyers and sellers freely communicate on price settles itself. I don't care if it's milk or gasoline or sneakers or a kilowatt hour of electricity. It settles itself when buyers and sellers freely communicate. And this doesn't exist in the U.S. supply chain. That even when someone's standing at the pharmacy register, there are all sorts of hidden rules that are encompassing that interaction with the patient and the pharmacy. And so, if you take an example of someone who has insurance, care if it's a government plan or if it's a commercial plan, but immediately a new rule set is introduced to the transaction. And that rule set is, what is not the price the pharmacy is willing to sell it for? That doesn't exist. What suddenly happens is, what is the price the insurance carrier has negotiated with the pharmacy in aggregate, possibly over a period of time or a performance condition or a series of pricing schedules, what is presented to that person at the register, which could vary for the same drug under the same plan for the same patient an hour later, possibly. And so it's these conditions of what we would say a negotiated discount, the lesser of discount, the lesser of what we call MAC, cost, or the lesser of cash that the pharmacy is being willing to sell it for. And there are all these conditions. And you would think that through all these conditions, it would get to the lowest price. And unfortunately, it doesn't, because it creates this artificial variability. And so the issue that you have many times is that the buy side, the actual person at the register, and also the buy side being their plan that's giving them this insurance or coverage, and the pharmacy, the seller, cannot freely communicate because they're constrained by these rules. And it just makes for such a clumsy, opaque, and inefficient marketplace. And so one of the things that we wanted to do was to free ourselves. We wanted to focus on technology and administration and better service. And so we took the approach of we don't encumber the price. In fact, I would like to step away entirely. Let the patient and the pharmacy communicate on price. And if the pharmacy wants to give a lower price, that's their decision. That's the way it should be. But I didn't want to have a situation where, one, we're encumbering the transaction with rules or restrictions. And two, I didn't want to have a situation where we had a conflict of interest. And that conflict of interest is oftentimes, do you make more money on more expensive things? And I wanted to stay away from that. If you just have a flat administrative fee, our job is to administrate, light, provide insights, and focus on that side of the business. Let someone else deal with the GPO and the pricing politics. And what we wanted to do is to be free and clear of that. So if my clinical team has to make a decision, drug A versus drug B, no one could ever point to us and say, well, you're picking drug B because you make more money on that. I would be like, in our model, we do not. And I think that's important. I'm not saying it's for everyone, but I'm saying for us, this was core to our philosophy and stuff.
And it's so right. In other countries, if you travel around the world, I mean, it's really, you go to a pharmacy and you can just pick up a drug, right, across the counter. And the manufacturer suggested retail price is printed boldly on that. So you know that you can pay less than that, but not more than that, right, for that particular drug. And then you come to US and certainly, the US needs to reimagine this whole pharma supply chain. And there's this loud call for transparency in prices. And, this country, of course, bears the cost for research and development costs and the patents and the clinical trials, because many other countries manufacture generic drugs. And so it's much cheaper there. But still, it would be good to declare to the public how much money and funding is gone in developing these medicines. So a little bit more transparency is needed on that. All that makes it very complicated. I mean, I guess, do you want to add a little bit more along that side? It's like, what can be done to change that?
Well, this is a very difficult conversation because I don't want to appear as someone who doesn't have an opinion by understanding both sides of the argument. So if I wanted to be a little bit cutthroat and mercenary and be like, it appears to some as if the United States basically supports the R&D initiative for the world in pharmaceuticals. Okay, I hear that. But is there a better way? And just because something started that way, does it need to be that way? And so, people will point very quickly, it costs a huge amount of money and an enormous amount of uncertainty to go down a certain path and try and go through clinical trials and get a drug to market. And things could even change while you're going to market, et cetera, be competitive forces, could be regulatory forces. You don't know. And I appreciate all these things. And so it is extremely difficult. You also have kind of a short period on your, you know what I mean? And I think this is the other, at least in the United States, the way you want to look at it is I could put all this time and effort, depending upon my clinical trials, I could have a very short period of time in market where I have an exclusive to monetize this investment. Now, here's the other side of the argument. Yes, but a lot of your R&D was funded by government and state programs and university systems and the clinical trials and the research that went on there. And, let's face it, you're subsidized maybe to the tune of 50, 60%. I don't know. They may say that's not true. You have so many other costs. And so I'm sensitive to both sides of the R&D question. And we want to have therapies that are cures. I mean, I think we live in a wonderful age where we're starting to see cures. Like, hey, this is the cure for this disease state. That didn't happen 20 years ago as often as it does today. And this happens with extraordinary investment, both from venture, from also the government, states involved with these programs, and obviously the private sector. And so all of this comes together, you could say in harmony or cacophony of voices, however you want to look at it, but it's the system we have today. Can it be improved? The answer is certainly, but I think you would have to look more globally to price and access, and it's not simple. And I always want to point that out. So you may say I've just pulled the ultimate political move and I had no opinion for the last 2 minutes, but it is the truth.
No, you're right. And, added complication in the USA is that's not just between the customer and the pharma companies. It's also the employer comes into play because they're the ones that are paying for the insurance, right? And the employer always feels that a healthy workforce saves them money. So that's just one more reason in believing that, the pharmacy benefits is kind of like an investment, right? So it would be good to
I couldn't
see.
agree more.
So
No,
tell the
and it's
listeners
important.
a little bit more about that customer satisfaction and the happiness factor. And go ahead. Yeah.
Yeah. I think pulling it all together. So going back to let's create efficiency around price. Let's not have conflicts of interest. So let's retask these resources to better service and better outcomes clinically. And to your point, we often say in the halls of our company that, healthcare is an investment, not a cost. And we can get out of that cost discussion once you free yourself of conflicts and you basically have a market that's much more efficient and transparent. And so where we measure our, metrics of success, our net promoter score, both the client side and the patient side. So on the customer side, we have a heroic 96 net promoter score. So basically means almost every single one of our customers is a reference.
And that's great because, the iPhone is a great product. And I believe their NPS is only like in the 70s or 80s or something. So 96 is like an amazing feat. So that's amazing.
Agreed.
Yeah.
Now, here's the other important metric, which is, well, what about the patient level? So we're talking the customer levels, typically an employer group or a health plan, something sizable that aggregates thousands of lives. But what about the patient? Are they happy under the model? And so we look to our call center net promoter score, which sits at 61. So in comparison in healthcare, our industry average against our main competitors is a 7. And so why is it so many times greater, better experience? And I go back to a couple different things. Is one, I think patients want to have problem solved real time. Nobody wants to be told in healthcare, oh, I can't help you, or someone may call you back. So when we built our platform, our model, and our system, and I keep going back to technology, is, Judy, which is short for adjudication. Judy is the brains behind our work. Everything runs on Judy. When I mean everything runs on Judy, every segment runs on Judy in our company. Because we wanted to create efficiency, we wanted to create observability, like everyone can see what the problem is, regardless of where you are in the company. And so when we looked at this, we wanted to respond to everything we could in real time. Can I have my call center at an associate level handle these requests? Get the information they require immediately, efficiently, and delay. And so we see handle times when we compare ourselves to other people, average handle time on our phone calls to be 50 or 60% faster, less time on the phone. So we're not only achieving what we would say efficiency in the scale and solution providing, and we're also looking at better outcomes where on the satisfaction side. And we also look at other things clinically, which is not just how fast do we resolve an issue, but what were the outcomes from those decisions? And we track these metrics very closely because I think you understand we're very focused on that service experience. We're absolutely committed to it at every level in our organization. It's a question we ask every employee coming in. We try and find people that care. It seems like such a weird quality, like caring is a quality that we hear. Like, yes, you're intelligent, you're hardworking, you're committed, but caring is an important part of someone's DNA when they come to work at Capital Arcs because I get on the phone with people when I need to, be it at the customer level, if someone has an issue or an emergency, from a client level, you want to make yourself accessible. And, one of the things that I point out is myself and my co-founders is, we spend, a shift every quarter on the phones. And people will be like, well, why do you do that? And I'm like, only the spoon knows what's stirring in the pot. Like, what kind of question? How good is the system? Can I answer the questions? You know what I mean? And I think this is extremely important as you continue to be focused on customer services. Are you willing to go into the trenches with your, colleagues and help people? And I love helping people. I honestly get an absolute kick out. There's nothing better than turning someone's day around. Someone's confused, scared, angry. I mean, in healthcare, you have a wide range of emotions you can get when you're coming onto a phone call looking for help. And I love turning around someone's experience. I love engaging with them. And I think this is an important part of our company. Everyone feels this.
And you really touched a very important point that in healthcare, you truly need to care. And that's where our motto comes in. We truly need to care as one because there's so many ecosystems in healthcare, each not talking to the other. And when you really bring it together, you come up with all the problems that we see. And if you care as one, then you will be able to solve all those problems. And you brought in Judy. I really love that. She seems like a super smart, efficient woman. Now, the brains behind the company. And I think that's what we need, efficiency. And when I look at healthcare systems, I think Medicare is a good example, right? Allowing Medicare to negotiate with pharmaceutical companies would be a big step towards making medicines affordable, right? So, what does the future hold for skyrocketing drug prices, and how can technology and innovation come into play, to make all this happen? Judy would be the answer here, right?
Well, I think that's exactly it. I think there are a lot of people dependent upon existing revenue in healthcare. But instead of just looking at your top line, and your bottom line with your current infrastructure costs, what if we started to look at back to this point of efficiency? Like people would say oftentimes, like, how do you compete much larger healthcare entities? And my point all the time is I don't need to operate at the same gross margin to basically create a profitable, healthy organization. And I think this is where it comes from is we had to invest considerably. Obviously, this is where you thank your investors and your VCs for giving you this opportunity to dream big and to take an important step for, I think, an entire industry. We've never really had a modern tech stack that focused on what I would call enterprise-wide infrastructure. I often compare this, this is my trite little example of if you were to go back in time with me to my office in 2000 and I'm using QuickBooks, all QuickBooks really did for me was print tax forms and run payroll. That's what it did. But if you fast forward to today and you look at QuickBooks or any enterprise HR platform, it will do all those things I discussed, but also it does a host of functions from help me buy pet insurance to unpack a 401k to my company. And really, what's the difference between what we would talk about claim processing, this middleware instruction of plan setup and really just processing an electronic claim, to an enterprise-wide solution, which is I'm trying to contemplate every workflow within the organization and how do I do it better and faster. And to be frank, if you answer these questions at a cheaper price point. And this is what I think is missing. So, returning to your question about more expensive medications and the cost to administrate, a lot of this can come down once the entire industry benefits from this instruction. And what I mean by this is the last hop in the supply chain is administrative. It's the administrative workflow between the triangulation on some level of the prescriber, the pharmacy, and the payer-patient relation. And if you could make this an efficient process for everyone, you are going to save money. And taking that money out can reduce costs. We don't need it. You know what I mean? And I just point this out. For 20 years, because of a lot of economic factors like inelastic demand curves, there was no need to change. And I think now we're seeing kind of this tipping point, I hate to use the phrase, of change is here. And it's not just us, it's a host of wonderful organizations that are getting us to where we need.
Yeah, no, you're right. Balancing this lower prices with better quality of care is what you're doing. And, you're targeting that. And that's really complex relationship between the quality and the cost and the US healthcare system. And another point that you brought out is all about this platform play, right? Instead of point solutions that are doing just revenue cycle management or just customer satisfaction, you create a platform that now does a lot of different things. And because it's doing so many different things, it can glean deeper insights into the understanding of the patient or the nature of the care, and can now do predictive prescriptive analytics that can actually help you in transforming the quality of care too, right?
Excellent point. And I always want to reinforce this. It's not necessarily what we see or believe. It's creating a platform. Yes, it's efficient, but also how do you give efficient access to those insights? Is it a plug and play environment where it's not just the payer, the employer, but they may have 16 different vendors that handle different therapeutic carve outs or different services? And how do they access the data efficiently? Share that information in a secure structure. And I think this is what we always want to point out is sure, we have our observations, and I think we make some truly meaningful contributions to better care. But what I love is, and a great example of this is each evening we transmit data to over 560 unique entities across the country. We have health plans, carriers, these could be consulting groups, data warehouses, stop loss carriers, third-party application providers, and it continues to grow. Each and every week, you have new requests coming in. And what I love is we just say, yes, sure. Why not? It's your data. You want this service. You would like to connect with these different partners. Perfect. Now, my experience is if we went back in time over healthcare over 20 years, oftentimes when payer would make requests, many entities in healthcare in general would say no. And no may be because they may not want to share data, but no also is they don't have an efficient way to access or share or monitor. And it becomes this insurmountable task. Like it's going to take me 6 months and $1 million to do this. And I would be like, this takes a junior engineer an hour. Like, seriously? And sometimes I wonder, does this person actually believe this? Or is this they're talking? And, no offense, they were just trained to say that. But this happens all too often in healthcare. And again, I get thrilled that we're changing entire attitude or philosophy.
It's amazing how technology can really transform workflows and make them super efficient. And your company is actually bringing down the cost of medicine with price transparency and technology. So super, super good that we have people like you solving problems that need to be solved. But I'm sure, as you've done this, you've had some challenges that you faced that we've not discussed as yet. Is there anything that you'd like to bring up and share with our audience that should be heard?
Yeah, I think, the bigger your goal, I often say, prepare more to be disappointed. And so what I mean by this is it's very easy to be a subject matter expert and have visibility to the problem. Well, this is the problem we've identified. And, if you're sharp and you have the resources, you could even create the solution. But oftentimes, why don't people adopt or move to your solution as fast as you would like? And, healthcare is a complex place and it often has conflicts of interest where people may like bad product because it pays more commission. People may like bad product because it's convenient. The status quo is so easy. And I have fallen victim to this. All right. I just want people to be like, wow, he's really on his pulpit sermonizing here. Now, I want to be clear here is this has happened to me. So we're a larger company. We've close to 400 employees now. I have to buy benefits each year for my own company. Well, guess who became a buyer? Well, me at scale now. And so what's fascinating to me is we have a wonderful broker and a wonderful relationship, but oftentimes I hear myself and my team saying things and I'm like, oh my goodness, we've become the problem. And this is where you get disappointed, is you're even disappointed in yourself because I hear myself saying, well, I wish we had more time. I wish we could. That sounds like a great solution. Just this isn't the year for me. The status quo is so easy. It's like a warm hug on a cold night and it's just waiting for you. And it's just like, here it is. It's the easy button. Just renew. Do whatever you did last time. And it's one of the reasons why, like a statistic that sat with me forever and it continues is like literally 1 in 60 employer groups will change any part of their plan design. And the average age of these plan designs often span to a decade. They haven't changed something in a decade. And it's like, I don't want to go into this. I'm going to have to get a ERISA attorneys. I'm going to have to, move this up executive committee. We're going to have to, test this. And you're like, that sounds like a lot of work, but I want to be fair, as even I have said this. So my advice to anyone is the bigger your goal, the bigger the mission, unfortunately, prepare to be disappointed. Because a lot of times just the inertia of the status quo and its ease is your biggest challenge.
And that goes back to the point you made earlier. Change is hard, and we are so used to that status quo that that incremental price tag that comes with the status quo is just ignored, and we just keep going, and that escalates the price, reduces the efficiency, and it's a whole cycle of life again. So I know we're running out of time now, but I just had one last question that you know we've gone through this crazy period of COVID, which I think we're never going to get out of with the Omicron coming in. And obviously, we cannot know for certain what the post COVID economy will look like. But we need to try our best to be prepared. And we can reasonably assume that the post COVID economy will be a trying time for many people across the globe. At the same time, this growth, there is growth, there is opportunity that you can, take advantage of. So, can you share some of the opportunities that you anticipate in this post COVID economy, and like how can your company take advantage of that and grow or scale during this time?
No, I mean, I agree with you. Where there's challenge, there's opportunity. I think I've heard the adage somewhere in my travels, and I agree. I think one of the things, the challenges of COVID have prompted, at least in my market space, health plans and employer groups to think about the future, to really consider change. That although it may be harder in some ways because, well, I don't want to contemplate too much change with this pandemic, but people have rethought both the workforce, care, benefits. And so I think you've kind of loosened, for me, some of the status quo that I've seen. I think it started out as more of an impediment and a challenge because I think the world was responding to what is going on here. And, how do we fix this or mitigate this on some level? But I think what I'm seeing now is we get to what I would say, I wouldn't say the complete cure phase of this, but I think we have a path forward phase. And with that path forward, I think it has allowed a lot of what I would say my customers, be it on the payer side, again, be it an employer group or a health plan, that are willing to suddenly say, hey, I need to look beyond next year. Like, what am I doing for the next 10 years? What are we doing for the next 20 years? What does this look like? And what do I need to be successful? And so I see COVID as the great awakening in healthcare. I think we've seen, I don't know if there's a correlation with this, but there's certainly been an increase in investment dollars in healthcare that has only gone up year over year. So, no one should be thankful for any pandemic, but I am thankful for some aspects that it brought. And I think it's this acceptance of change. And I think it is funding, not just for our company, but I think all the companies to come, because this is what you're going to need. You're going to need funding for people to dream big, to change the way healthcare operates. And this is what I think is one of those.
That's true. I really like what you said. It's the great awakening, right? We are getting into this stage of enlightenment and change. Change is what COVID has brought about. And that's really good for companies like yours that are truly transforming healthcare. So thank you, AJ, for taking this time to chat with us today and sharing your knowledge on this drug pricing efficiency through technology. It has been an eye-opener for me, and I'm sure many of our listeners have learned a lot of new things through you. And to the audience that we will have, thank you for listening. Don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned for more CareAsOne podcasts and episodes and discussions on trending healthcare topics that you care about. So send in your suggestions on speakers and topics, and we will try our best to address them. And if you wish to join our community, please join CareAsOne, community.careasone.org, to post your thoughts and network with your peers. I'm Dipti Desai, and I hope you have a great rest of the day.